CA-125 Biomarker in Ovarian Cancer, Clinical Applications and Interpretation. CA-125 is a protein marker elevated in ovarian cancer that aids in diagnosis, prognosis, and treatment monitoring. Understanding its role helps clinicians optimize patient care and surveillance strategies. Understanding CA-125 and its significance in ovarian cancer. CA-125, also known as cancer antigen 125, represents a protein found in elevated concentrations within the bloodstream of many patients diagnosed with ovarian cancer. This tumor-associated antigen serves as a valuable biological marker that oncologists employ to assist in the diagnostic process, evaluate treatment effectiveness, and monitor for disease recurrence. The presence of elevated CA-125 levels can provide clinicians with critical information regarding disease progression and patient prognosis. While CA-125 is not specific to ovarian cancer alone, its measurement has become an integral component of comprehensive ovarian cancer management strategies. Understanding the nuances of this biomarker enables healthcare providers to make informed clinical decisions and patients to participate actively in their treatment planning. The biology and production of CA-125. CA-125 is a large glycoprotein produced by various cell types throughout the body, including normal ovarian epithelial cells. Under physiological conditions, small amounts of this protein circulate in the bloodstream at relatively low concentrations. However, when malignant transformation occurs within ovarian tissue or related structures such as the fallopian tubes or peritoneal lining, cancer cells often produce excessive quantities of this antigen. The exact biological function of CA-125 remains incompletely understood, but its overexpression appears related to the aggressive behavior and metastatic potential of epithelial ovarian cancers. Certain benign conditions and normal physiological processes can also trigger CA-125 elevation, which is crucial for clinicians to recognize when interpreting results. Clinical applications in ovarian cancer diagnosis. While CA-125 should never serve as a standalone diagnostic tool for ovarian cancer, it functions as a valuable adjunctive marker when combined with radiological imaging and clinical assessment. Women presenting with symptoms suggestive of ovarian malignancy, such as persistent abdominal distension, pelvic discomfort, or unexplained gastrointestinal symptoms, often undergo CA-125 measurement as part of their initial evaluation. Elevated levels combined with radiological findings consistent with ovarian pathology strengthen clinical suspicion and may facilitate earlier consultation with gynecologic oncology specialists. The integration of CA-125 results with pelvic ultrasound and computed tomography improves diagnostic accuracy compared to either modality alone. However, the specificity limitations of this marker necessitate confirmatory diagnosis through tissue sampling or biopsy. CA-125 levels and risk assessment. Key points: normal CA-125 levels typically range from 0 to 35 units per milliliter, though reference ranges may vary between laboratories. Levels moderately elevated, 35 to 100 U/ml, warrant further investigation but may result from benign conditions. Substantially elevated values, greater than 100 U/ml, in conjunction with imaging findings raise significant concern for malignancy. Extremely high levels, greater than 500 U/ml, often correlate with advanced stage disease and higher tumor burden. Monitoring treatment response and recurrence. Following chemotherapy or surgical intervention, serial CA-125 measurements provide objective evidence of treatment efficacy. A declining trend in CA-125 values typically indicates positive response to therapy, whereas plateau or rising values may suggest treatment resistance or disease progression. Oncologists frequently establish baseline measurements prior to initiating treatment, then monitor levels at regular intervals throughout the therapeutic course. Significant drops in CA-125, particularly when combined with clinical improvement and radiological evidence of tumor shrinkage, correlate with improved survival outcomes. Conversely, rising CA-125 levels may herald cancer recurrence months or even years before symptoms become apparent or imaging detects structural changes. This early warning capability allows clinicians to intervene promptly with salvage therapies or adjust treatment strategies before extensive metastatic disease develops. Limitations and false positive considerations. Despite its clinical utility, CA-125 possesses significant limitations that practitioners must acknowledge. Numerous benign gynecological and systemic conditions produce elevated CA-125 independent of malignancy, including endometriosis, uterine fibroids, menstruation, pregnancy, and various inflammatory processes affecting the peritoneum or pleura. Additionally, certain non-gynecological malignancies including breast, pancreatic, and lung cancers can elevate CA-125, limiting its diagnostic specificity. Approximately 20 to 30% of early-stage ovarian cancers present with normal CA-125 concentrations, rendering this marker unsuitable for screening asymptomatic populations. Individual patient variations in baseline CA-125 production further complicate interpretation. These limitations underscore the importance of integrating CA-125 results within the broader clinical context rather than relying on this single parameter for diagnostic or therapeutic decisions. Prognostic implications of CA-125 values. The magnitude of CA-125 elevation at diagnosis carries prognostic significance in ovarian cancer management. Patients presenting with markedly elevated CA-125 levels typically have more advanced disease with greater extent of peritoneal involvement and higher likelihood of distant metastases. Research demonstrates that patients with pre-treatment CA-125 values exceeding 500 U/ml often experience shorter progression-free survival and overall survival compared to those with lower values. The rate of CA-125 decline following chemotherapy initiation also provides prognostic information. Rapid reduction suggests chemosensitivity and predicts better treatment outcomes. Conversely, persistence or slow decline in CA-125 despite active chemotherapy may indicate inherent chemoresistance and warrant consideration of alternative therapeutic approaches. These prognostic associations help oncologists establish realistic treatment expectations and facilitate prognostic counseling with patients and families. CA-125 in different disease stages and histological subtypes. CA-125 elevation correlates with advancing disease stage in epithelial ovarian cancer, with higher percentages of patients exhibiting elevation in advanced stage disease compared to early stage presentations. Approximately 50% of stage I ovarian cancers demonstrate elevated CA-125, whereas 90% or more of stage 3 to 4 cases show elevation. However, certain histological subtypes of ovarian cancer exhibit different CA-125 patterns. Clear cell and mucinous ovarian cancers produce CA-125 less frequently than high-grade serous carcinomas, necessitating supplementary biomarker evaluation for these subtypes. Some patients with ovarian cancer of mucinous origin may have normal CA-125 levels despite significant disease burden, requiring clinicians to incorporate additional tumor markers such as carcinoembryonic antigen and cancer antigen 19-9. Recognition of these histological variations ensures appropriate interpretation of biomarker results across diverse ovarian cancer presentations. Integration with other diagnostic modalities. Modern ovarian cancer diagnosis and management employ CA-125 as one component of a multimodal assessment strategy. Transvaginal ultrasound provides superior visualization of ovarian morphology and assists in distinguishing benign from malignant characteristics. Computed tomography and magnetic resonance imaging evaluate disease extent, peritoneal involvement, and metastatic spread. Combined assessment scoring systems integrate CA-125 values with radiological findings to enhance diagnostic accuracy. Clinical examination findings, patient symptomatology, and risk factors further inform the diagnostic evaluation. This integrative approach maximizes diagnostic sensitivity and specificity while minimizing unnecessary interventions for benign conditions. The combination of elevated CA-125 with imaging evidence of a complex adnexal mass, ascites, and peritoneal involvement substantially increases the likelihood of malignancy and warrants urgent specialist referral. CA-125 surveillance and maintenance therapy considerations. Following completion of primary chemotherapy, CA-125 monitoring continues during extended surveillance periods to detect early evidence of recurrence. Some patients achieve complete response with CA-125 normalization, while others maintain persistently elevated levels despite clinical remission. The optimal frequency of CA-125 testing during surveillance remains debated, with some evidence suggesting that routine measurement in asymptomatic patients may not alter clinical outcomes significantly. However, CA-125 elevation in previously normal levels warrants prompt clinical evaluation and imaging to assess for recurrence. In select patients receiving maintenance therapy following chemotherapy, CA-125 trending guides continuation or modification of treatment strategies. The combination of clinical assessment, imaging, and CA-125 values provides the most comprehensive approach to long-term follow-up and recurrence detection. Emerging applications and future perspectives. Contemporary research explores refined utilization of CA-125 through rate of change analysis and integration with additional tumor markers and genomic biomarkers. The pace of CA-125 increase between measurements provides supplementary prognostic information beyond absolute values. Multiplexed biomarker panels combining CA-125 with emerging markers such as cancer antigen 27 to 29, tissue polypeptide antigen, and HE4 enhance detection sensitivity and specificity compared to CA-125 alone. Circulating tumor DNA and exosomal markers represent next-generation biomarkers that may eventually complement or supersede traditional protein markers. Artificial intelligence and machine learning algorithms increasingly integrate CA-125 data with clinical variables and imaging findings to generate individualized risk predictions. These evolving methodologies promise enhanced precision in ovarian cancer detection, prognostication, and treatment personalization as technology advances and validation studies mature. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.